All right.
Okay. Dun, 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 dun. I always end up singing it like it's Mission Impossible. Dun, 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 dun.
I don't think I even know the full Mission Impossible. All right.
Okay.
Retake. Okay, so because we're recording this over Zoom, this is going to be even harder for me to line up. Anyway, let's see if we can just do one wow in sync.
Okay. You're gonna...
So it's playing. Dun, 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 dun.
Sorry, I was going to count it in.
Okay, we just got yeah.
Wow.
Future Karinda is going to be furious at that one.
Welcome to the Nuanced Naturopaths. Please take us seriously.
We have a lot of fun. Please rate us 5 stars and take us seriously and hit that follow or subscribe button.
Yeah.
Hi, I'm Karinda.
And I'm Julie.
And we are the Nuanced Naturopaths.
And we are the Nuanced Naturopaths. And we are serious professionals.
That was good. Today,
yes,
we come at you with
that's a bit aggressive.
Today we're here to warm your ear holes and enhance your auditory visual experience of media with a pretty, I would say, juicy deep dive into a complex. Gosh, what do we even call it? Do we call it a disease, a symptomology,
condition, perhaps?
Condition. Yeah, disease feels too severe.
Yeah,
condition. Yeah. This was. I do need to do a gentle shout out to our number one fan. If you're listening, you know who you are. This was an episode request, and the topic is lipedema, and this is admittedly something that I knew of. I'd had probably honestly the most I had probably dealt with it was from conversations with you, actually. Just like talking about it with you in the context of patients, or just seeing it, or just in conversations that we would have about obesity and weight. It would sort of come up as a subsect. Other than that, it's not on my radar much. I can't say that I've treated any clients with it, but before we dive in, what is your knowledge or experience of lipedema?
Well, now, first of all, I just got to backtrack a little bit because I am also aware of another number one fan.
Oh.
So there are 2 number one fans, and I just don't want to minimise anybody's experience of the Nuanced Naturopaths.
Well, actually, we can. We've got the number one fan that sort of is more connected to you.
Yeah.
And we've got the number one fan that is more connected to me, which is interesting.
That's true.
That's actually interesting in and of itself. Like who listeners choose to reach out to. I love it. I'm here for it. Yeah. So we can have our own leaderboards.
Not that it's a competition.
Not that it's a competition.
Because I feel like you'd win if there was a
for our love.
We love you all. We do. We do.
No, I wouldn't win. I'm not a contender. It's only our fans that are contenders.
That's true. No, but I'm. Oh, okay. Yes. That's. Yeah,
are you saying that it would be my leaderboard that would get more fans?
That's what I thought you were saying. Is that like it's now open? It's changed the dynamics of the relationship entirely.
We have a very special event coming up mid-year. It's going to be the Julie versus Karinda Naturopathic Showdown. We're going to be seeing who can pour and formulate liquid herbal mixes the fastest. We're going to see who can research the 5 latest journal articles available on PubMed on any given condition. Julie's going to win that one. We're going to go through the top 5 root causes of 10 rapid-fire diseases. And
The playoffs.
We're going to have a speed run, speed run of the naturopathic principles that direct all naturopathic treatment. We're going to have
wow.
see who can list the most naturopathic founders, who are the forefathers of naturopathy.
Oh wow, this is tough. I'm going to have to study for this.
Well, yeah, we're not doing it now. This is just the promo for it.
Okay. All right,
And if you would.
go on.
If you heard me give that joke promotion and you would pay to see that live, let us know, because we can do like a fundraiser event.
Yes.
Live stream on Twitch, live stream on YouTube.
You're going to have to teach me. I don't even know how to get onto Twitch.
No, that's right. No. We'll be live together. We'll be in
Okay,
the same
all right.
room for it.
Okay.
Yeah, and imagine Emmy officiates.
Yeah, definitely.
Definitely shout out Emmy.
Yeah. I miss you, Emmy.
All right, sorry.
All right, okay. So to answer
derail.
To answer the question, my experience of lipedema is actually not a lot, not a great deal, other than my obsessive nature in terms of learning and studying things. And I did have a patient a very long time ago who came to me for another reason, who also had lipedema. And she was surprised that I knew what it was. Pleasantly surprised, because she'd had a long journey in getting a correct diagnosis. And, and it was really quite frustrating because, and I think this is the experience, I get a sense of this from what I've heard from other naturopaths talking about it, and just from the little contact I've had with people, is that for the most part, treatment strategies given by many practitioners, probably across the board, is dietary strategies to lose weight, working with the assumption that this is an obesity problem or a metabolism problem, and it's actually got nothing to do with metabolism.
It's a lot more specific than that. Hey?
Yeah.
Okay.
Yeah.
And I guess that leads to like the first point that I know you especially wanted to highlight, is that this is fairly new territory, right?
Yeah.
This is a fairly new diagnosis. What did you say before? Is it like in the last 5 years?
I think I think it was probably within the last 5 years there's been an explosion of the literature, or not an explosion, but an increase in the literature.
Right.
But previous to that, it was relatively unknown. It's existed probably for millennia, but its understanding has only been very recent. And I think probably just within the last, let's say 5 to 10 years, the understanding that differentiates it from lymphedema or obesity, or even metabolic conditions, has been more clearly elucidated.
Great word. I like it. And so I guess as a result, well, as you mentioned with that client of yours, the diagnosis can be a long and I imagine winding journey for a lot, because it's only being newly differentiated. There's not a lot of practitioners who would specialise in something like lipedema.
Yeah. And I think for the most part, a lot of the normal strategies, the Western medicine strategies, are not that helpful.
Yeah, especially if they're generalizing it, if they're either lumping it, and we're going to comb through all of this. They're either generalizing it with like general obesity or like excess adiposity and giving people blanket diet advice that theoretically should result in weight loss, or they've got it too interwoven with lymphedema, which is a different condition.
Yeah.
And maybe that's where
Maybe it is.
Is that where we start?
I think just one thing I'd like to acknowledge before we launch into this is that there are women out there who haven't been heard for such a long time, and often it does co-occur with obesity or with metabolic problems, but they're two separate issues. Just because they're comorbid doesn't mean that they're correlated.
One in the same.
And so there are women out there who have lipedema who are trying desperately hard to exercise this excess adipose tissue off, and unsuccessfully. And I think it really can impact on their mental health. So I just wanted to acknowledge that it would be really tough to go through that. And I guess that's one of the things that as naturopaths we do really well, is that we see the whole person, and so we're also looking at how this can impact you in terms of your mental health and your nervous system health, which of course feeds back into the condition. So
absolutely, yeah.
Yes,
Big agree.
Yeah. So where will we going? Symptomatology.
We're going to symptomatology. So when we go through, let's tell you what lipedema is. But as we go through this, we are going to sort of do a gentle comparison with lymphedema, because as Julie pointed out to me earlier, is that it's commonly confused with lymphedema, but they're different, but they have some similarities. So we're going to do a little bit of a crossover, and then we're going to get into some things that are more specific to lipedema without lymphedema crossing over.
Yeah.
But let's start with, what is lipedema?
What is lipedema? Lipedema is a symmetrical fat accumulation often in the arms, often in the legs, arms, and sometimes in the trunk area. The tissue itself is soft and kind of doughy, squishy. It dimples easily, and that's where sometimes lymphedema can get confused. It's often painful to touch.
Interesting.
So, very pressure sensitive. It bruises easily. This is one of the defining characteristics.
Okay. And just from those 2 points alone, pain and tenderness and bruises easily, my brain already starts sort of thinking along an inflammation pathway, which we'll get to. And I also think of the vascular component. Where there's bruising, there's blood, and there's delicate vasculature. So I'm sure we'll get into that, but that's my naturopathic brain starts thinking about that. Yeah.
Feet and hands are typically excluded. So you can end up with this sort of cuffing effect. You know how like a baby has, chunky little limbs, and then they have, it almost looks like there's a rubber band around the wrist or so. This is another defining characteristic, because it doesn't go into the hands and the feet. It's often progressive, so it worsens over time, and it's often triggered or worsened by hormonal changes. And this is because, of course, during pregnancy, puberty, menopause, there's these fluctuations that occurs.
Yep. Okay, and we'll explore that a little bit more later on. And then I guess maybe I'll go through the lymphedema components. So I always love breaking down words. So the first thing I notice is that both of these words, lipedema and lymphedema, both have edema. So when we see edema as a suffix, in my brain, I'm like, that's relating to swelling. That's relating to fluid accumulation somewhere or some kind of swelling.
Well, this is a bit of a misnomer when it comes to lipedema, and actually speaks to the misunderstanding, because it's
true. I just thought that
because it's not a true edema. There is fluid involvement, but it's not an edema.
Yeah, the appearance of accumulated tissue is not solely from fluid swelling, right? Okay, interesting. Whereas true edema is from fluid.
Yeah.
And so that's where the word lymphedema is more true. So when I see lipe at the start of a word, I think that's related to fat, that's related to adipose tissue. When I see lymph, I'm like, okay, that's related to lymphatics, whether it's lymphatic fluid or lymphatic vessels or, the lymphatic system in our body, which is a really important part of the immune system, but also just the whole body. So first key difference is that lymphedema can be unilateral or bilateral swelling. So where lipedema is going to be symmetrical in that you're going to see, if it's on the legs, you're going to see it relatively equally on both legs. Lymphedema can be just affecting one side of the body or just one leg, but it also can be both. Interesting. You can help me elucidate this. So it's okay, interesting. This is taking me back to clinical skills. Lymphedema is a firm, non-pitting edema that progresses to fibrotic tissue. So when we talk about pitting, this is something that we look out for when we're looking at swelling in the calves, for example. Just as a clinical tool, we'll press our thumb gently onto the front of the calf and we'll see, I should say calf, not calf.
It's on the shins, to be right on the shin bone.
On the yep, that's right. The front.
Yeah, the front of the calf.
At the back, and I was like, what's the front of the calf called? Oh my god, shin. Yes. So we press into the shin bone, along the shin bone, sort of at different points, and we look to see if the tissue sort of stays indented for a bit before it returns to a flush state, and we refer to that as pitting. So the fact that lymphedema is a non-pitting edema would mean that when we do press down on that shin, the tissue will go in as we press it, perhaps a little bit, but there's not going to be an indentation when we remove our thumb.
Much like when you're baking, you can tell when the cake is cooked. You might press on it and it springs back up. Whereas if you press, it's not cooked, you press it in and it stays indented.
Good analogy, actually. Didn't think of that. Julie's the baker of the two of us. Now, that progresses to fibrotic tissue. So I read fibrotic tissue and I think of fibrosis and I think of hardening of tissues, and that would explain why it doesn't have that pitting component. But I actually didn't know that about lymphedema, that it progresses to fibrotic tissue.
I didn't know that either, and that's really interesting because fibrotic tissue says to me that the fascia is actually transforming from a gel to a solid, hardening up.
Crystallizing a bit,
which is
okay. Good for our brains to clock that. Now, another key difference, lymphedema is generally painless unless it gets infected, whereas lipedema can be pain and tender to the touch. Here we go. Lymphedema also comes with what we call a positive Stemmer's sign, which is an inability to pinch toe or finger skin. What? Is it so fibrotic that...
Well, it's firm. It's like you can't grip enough of the skin is not loose.
Elastic.
Elastic. Like, here we go. Like, on the back of my head. I don't know if you can see that. Can you see that?
Yeah.
It's like trying to grab a balloon.
Okay.
Or due to thickened skin, it says.
Oh, okay. Just another interesting component of it. It does include feet and hands in the swelling pattern, whereas in lipedema, we'll see that, as you mentioned, that cut-off point, that cuffing appearance. Lymphedema may come with recurrent infections, cellulitis, that is painful.
Yeah.
That is a nasty, nasty infection. Now, can also sometimes present with, so thickening and hardening of the skin, and sometimes lymphorrhea. Now don't tell me.
Okay.
If I'm just using my word processing unit, also known as my brain. So lymph refers to something lymphatic. When I see urea, like diarrhea or leukorrhea, I think of like an excess fluid, or like But where would that be coming? Where lymph is coming out of something?
Yes, leakage of fluid through the skin. So it's such a build-up of fluid. It's actually, it actually leaks out.
Oh, that sounds awful. Okay, so, and again, to clarify, that's lymphedema, not with lipedema.
I would say that, that would be in an extreme case where it's not being, treatment is not really being helpful. Yeah.
Yeah, okay. So they're the key differences in how these present in the symptomology. Now let's explore what we call the pathophysiology, which is the understanding of like what is driving these conditions, how do these conditions occur in the first place. We're going to start with lipedema and go into a little bit more depth about it, and then just sort of distinguish how that's different from lymphedema. Okay, pathophysiology of lipedema. There is abnormal subcutaneous fat distribution and inflammation. There's impaired lymphatic function secondary to fat tissue expansion. So there's not sufficient lymphatic drainage in these areas where there's this abnormal fat distribution. There's also a genetic component.
Yeah.
Familial clustering observed.
So often it doesn't, because it runs in families, often, predominantly women, rarely men. That's a good question. I don't know if it occurs in men at all.
I'm just going to quickly go prevalence of lipedema in males.
Yeah. And so mother, sisters, aunties, all have this same presentation, and so it appears normal. It's just the family thing,
Yep. Okay. And what's interesting is that I was reading an article that we'll get into a bit from 2021 that was saying a genetic component hasn't really been observed, but I know there's been more recent research saying, we've tracked some genes that females with lipedema do have. And just on that gender difference, so I'm reading something from 2023. This is, you would know, Stat Pearls.
Oh yeah, yep.
It's a continuing education activity, like right up. Lipedema occurs predominantly in females, but has been reported rarely in males. Few reports mention the prevalence of lipedema around 11% in adults and 6.5 in the US. No, I wanted more specific than that. Okay, hang on. Lipedema in men is uncommon, but few cases have been reported in liver disease or low testosterone, both of which have high estrogen states.
Interesting.
That is interesting. Lipedema is also found in cases with polycystic ovarian disease where testosterone levels are high. more that, and then that complicates it. But so that's when we close the tab. Actually, no, that's when I reopen the tab and copy and paste it into our show notes and save that for later.
Say if it's, with the genetic, whether they've identified a genetic link or not, I think I don't think it's disputed that it does appear to run in families, at least anecdotally. And that makes you wonder whether, men are more of a carrier of the gene.
Yeah, right.
Well, because of the hormonal influence.
Yeah.
They may not have the presentation of it.
Yeah.
But they carry it and pass it on to daughters.
Yep. Oh, that's interesting. Oh, I wonder. I imagine that we don't have that information yet because it's just such a relatively new area of research.
I don't know, and I haven't looked that up. Yeah,
and that's okay. And we've already got enough to cover. So
you're seeing how our brains work here when we're becoming familiar with something.
Oh yeah. So another component of the pathophysiology of lipedema is that there is hormonal influence on fat cell metabolism and how those fat cells are distributed. This is a key part that we're going to go into a little bit more depth on. And there's also chronic inflammation observed in the adipose tissue. We're going to compare the difference between, I naturally wanted to start to get into it now, but I'm going to hold myself back and say we're going to compare the difference between lipedema, fat tissue, and regular fat tissue, and that is probably going to answer some of the questions my brain has right now. Like, is all fat tissue influenced by hormones, or is all fat tissue chronically inflamed? And I'm sure we will cover that.
Yeah. Well, in this case, part of that inflammatory process is one of the things that they have identified in lipedema is this M2 macrophage polarization, which means with the macrophages, they're both involved in the inflammatory process. The M1 is more associated with the instigation of inflammation, remembering that inflammation is not good or bad, it is a process, and it's a process that's necessary for healing. The M2 is more involved in the resolution, so it's more promoting tissue repair and healing, reducing inflammation. Now this is where it gets confusing. Okay. But it also increases fat tissue growth and blood vessel formation, and so it creates this pro-growth kind of environment in tissues. And this chronic M2 macrophage activation, then it signals more fat cell growth, and which then triggers more M2 activation. So it's like part of the inflammatory process gets stuck.
Yeah, and on a increasing loop.
On an increasing loop that is fat building, tissue building, which, most of our processes in our body after we're children are breaking down processes rather than building up processes. They're anabolic and catabolic. So it's like this healing response becomes part of the problem.
Yeah. I can see how that's so tricky, and this almost explains, how you mentioned in the symptomology, lipedema gets worse over time. It's generally progressive. I feel like this answers why it is progressive, because unless you are, in terms of your treatment targets, unless you are so specifically honing in on this pathway, on this M2 macrophage polarization, it feels like it's just going to keep growing.
Yeah.
Okay.
Yeah. That explains why the lipedema fat is different from regular fat. So
Okay.
it also explains why fat loss doesn't work for lipedema,
Yeah.
and why anti-inflammatory processes might help. So something that truly resolves that anti-inflammatory process is going to be more beneficial than anything else. So,
Beautiful, okay.
if you have lipedema, you want to, more than anyone else, more than the average person, want to be avoiding those pro-inflammatory lifestyle diet activities.
Yep, which we're definitely going to cover, hey, when we talk about some treatment strategies and things that you can try and things that you can avoid. Okay, so that's the pathophysiology of lipedema, and that really shines a light on that real immunology kind of aspect to it. And I guess to clarify, it's multifactorial. There's hormones at play. There's this immune dysregulation at play, inflammation, which I sort of always pair with the immune system as well. There's a few things going on. Compared to lymphedema, which there can be primary and secondary lymphedema in terms of what's causing it. In terms of primary lymphedema, that can be congenital, like that there's just malformations to the lymphatic system. I'm guessing in a way that it just does not drain efficiently, and there are areas of the body where that lymphatic fluid just accumulates. In terms of secondary pathophys considerations for lymphedema, there might be acquired damage to the lymphatic system. That could be from surgery or radiation or infection or some kind of trauma or accident. That physically kind of damages the lymphatic system, or, parts of it, maybe important clusters of nodes or some of the important vasculature, the vessels of the lymphatic system.
Which reminds me too, when we're talking about, did we mention the association between lipedema and insulin resistance? Well, this comes up later on. But with lymphedema, it does occur with type 2 diabetes when there is that poor circulation, disruptions to the vasculature of the extremities, and so that would be another one of these secondary conditions. Sorry. I just wanted to, because we're going to mention insulin resistance later on, I just wanted to draw a difference between those two.
I think that's good. Beautiful. Another consideration when it comes to lymphedema is that there may be protein-rich fluid accumulation in the interstitial spaces. I'm wondering if that then obstructing lymphatic vessels, or is that directly encouraging swelling?
Well, this is where you get the lymph fluid in a healthy person is thin, viscous, and clear. Lymphatic fluid, when it's unhealthy, is thick and cloudy, and it's cloudy because it's got these proteins in it. Because it's sluggish, it's not moving around. It's I guess it's the same thing that happens to water outside the body on the earth. That if it stagnates, it gets, water needs to be moving.
Yes, okay. So where there's stagnation, there's accumulation, and that's not great. Interesting about, I wasn't aware of the protein component to the lymphatic fluid that could become problematic. There's progressive fibrosis and tissue hardening that would obviously affect lymphatic flow, and the immune system might be compromised in certain areas of the body, and that could just from that alone, that could affect the lymphatic flow and drainage in specific areas. So when it comes to diagnosing the two, and I guess specifically diagnosing lipedema, which has been poorly or misdiagnosed, I guess still is, but we're sort of on the path to correcting that. What are some of the diagnostic differences there?
Well, in lipedema, there's the family history, that genetic component. There's the hormonal triggers. So people would notice a fluctuation at different times of the cycle, at different times of their reproductive life. The symmetrical presentation, so it's equal on both sides. Pain and tenderness, that sort of squishy presentation also to the cells. And also you can get the sort of cottage cheese look to it as well.
Right.
The sort of cellulitis.
When you say the cottage cheese look, is that sort of referring to like the real dimply kind of pattern that it can have?
Yeah.
Like, is it caused by the dimples, would you say? Okay, cool. Just getting a picture in my head. And then comparing that to lymphedema, again, remember, it can just be on one side. It can just be unilateral. It's not going to be on both sides. Has there been a history of trauma or surgery or infection? Check that positive Stemmer's sign, which is the inability to pinch the tips of the fingers and toes. And I guess lymphedema can also be diagnosed with imaging.
Shall I say it?
Yeah.
LymphoScintigraphy.
Oh, that's easy. LymphoScintigraphy. Scintigraphy, also known as a gamma scan, is a diagnostic test in nuclear medicine where radioisotopes attached to drugs that travel to a specific organ or tissue are taken internally and then emitted. And then the emitted gamma radiation is captured by gamma cameras, which are external detectors that form two-dimensional images in a process similar to the capture of X-ray images.
I have heard of this before. Yes.
Yeah, me
apparently,
too.
And apparently it's very, very uncomfortable.
I could imagine. Radioactive isotopes going in to parts of your body and then
that are already painful.
Yeah. And then the gamma. No, yeah. Okay, yeah. Great. So they can do that. Or there's MRIs, or there's ultrasounds, and that can help differentiate the tissue types in the lymphedema. Also, and maybe the most complex aspect is that both conditions can coexist, which we would refer to as lipolymphedema. So you can have lipedema, lipedema
and lymphedema.
And lymphedema.
At the same time.
That would be tough and shit. But there is a crossover in terms of treatment. Do we want to go over the conventional treatment strategies?
Just briefly, I think.
Okay.
Yeah. So conventional treatment strategies may include complete decongestive therapy, which is a kind of a combination treatment, which has limited effectiveness. So we'll skim over that. Compression garments, I know that they're used a lot for symptom management. Liposuction, there's some specialised techniques like tumescent or water-assisted liposuction.
Interesting.
I'm not really across those, but liposuction sounds pretty intrusive.
Yeah, and obviously not addressing the root of it.
Yeah.
Really just structural.
Yeah.
Aesthetic correction, I guess.
Yeah. Pain management with analgesics, which it's not ideal because it would need to be long-term. Physical therapy and exercise, so aquatic therapy is particularly beneficial. I can see that. Weight management, though standard weight loss is often ineffective in lipedema fat. So, this is the frustrating part, is it's again, and because there's such a stigma with obesity of any kind, just it's not you. It's not your fault. Lymphedema.
Yeah, so again, complete decongestive therapy where there's limited effectiveness in lipedema. This is the gold standard conventional treatment for lymphedema. There's also manual lymphatic drainage, which I imagine we are both big fans of, and we would encourage even if you didn't have lymphedema. Multi-layer compression bandaging compression garments, using higher pressure garments than you would use in lipedema. Exercise therapy with compression makes sense, getting things moving. Skincare and infection prevention protocols, especially in cases where there's maybe been cellulitis in the past, or where there's been specific infections in the affected areas where there's the lymphedema. Yeah.
Also worth mentioning too that lymphedema is quite common in women who've had breast cancer surgeries.
Yes.
So of course they take out the lymph nodes, which means that there's a dysfunction then in the arm. So the lymph nodes are usually removed. The ones that are sort of like in the armpit are usually removed, and then that causes the accumulation in the arm. Yeah. Yeah, I've seen that. Yeah, me too.
So, complementary medicine approaches.
That's us.
That's us. We're complementary.
We're so...
You look very nice today, Julie.
So do you.
Also complimentary.
Love your hair. It's gorgeous.
No, I know that's genuine because you mentioned it before. Thank you for taking that opportunity for a genuine compliment.
We're so complimentary. Okay, so of course, being holistic practitioners, we would be treating the person in front of us with whatever confluence of symptoms or presentation they have. But we would be focused.
So these are just general...
These are just general things, yeah.
I guess good to clarify, these may not work for you. This is not equivalent to tailored advice to your whole being. These are some things that we would consider in a person presenting with lipedema or lymphedema to start off with.
Yeah.
What can we use for both conditions?
An anti-inflammatory diet would be a great start. So a diet that is really high in whole fruits and vegetables and really low in refined carbohydrates and seed oils and
high in those nice anti-inflammatory fats like omega-3s. I mean, balancing your omega-3s with your 6s. It's not all about the omega-3s, but good quality fish, good quality oils, good quality nuts and seeds, and I think what avocados are considered a fruit, right?
Yes.
But maybe not technically.
No, technically it's a fruit.
Yeah.
Yeah, it's got a seed on the
cool.
It's got a seed on the inside.
Interesting. Oh, it's strawberries that aren't the real fruit.
That's
the
right.
Seeds are on the outside.
Yeah.
Hey.
Yeah. Tomatoes are a fruit. Yeah. Anyway.
And that's for another podcast.
Yeah. So, anti-inflammatory diet, also low carbohydrate. So, some of the ketogenic approaches are showing promise without focusing too heavily on ketogenic, because there's a whole podcast in talking about ketogenic diets in therapeutic uses, because you've got to balance that off with damage that can occur to the gut microbiome specifically, because as soon as you start cutting out some of the things that are carbohydrates, complex carbohydrates, you're cutting out fibres that feed specific species, which are beneficial because they make metabolites that reduce inflammation.
Yeah. So we're going to take that aspect with a grain. We're going to acknowledge that, okay, some ketogenic-based approaches have been showing promise for the resolution or for the support of lipedema and lymphedema, but we're going to take it with a grain of salt.
Yeah. And maybe, not so much, because ketogenic is usually defined as, 50 grams to 100 grams of carbohydrates in a day. Whereas if you just kept it low carb and those carbohydrates are complex, I'd be happy with that.
Okay.
Sorry. I'm just adding more
Julie's
detail.
Stamp of approval.
Just adding more detail where it maybe wasn't appropriate.
That's okay. I'll allow it.
So some lymphatic specific herbs like red root, calendula, cleavers. There's probably about 1,000 others that we could include in there, but they'd be a good start. Dry brushing and manual lymphatic techniques. Perfect. Love that.
And we would recommend that, again, for people who didn't have these conditions. That's just a great practice to keep your lymphatic system nice and flowy and healthy.
Shout out to Lymph Love Club on Instagram. She is the best. And she has lots of tips, little techniques of how you can every day just perform these little 2-minute routines to help with your lymphatic flow. Nutritional support. So we're going back to the dietary interventions, vitamin C, bioflavonoids, omega-3s, as Karinda said. All of these things are going to help move lymph around and reduce inflammation. And this is in both conditions. But we have some lipedema specific ones here.
Yeah, the main thing I think that would be different about treating lipedema is focusing on the hormones, as we've touched on, especially when it comes to estrogen metabolism and looking at those key points across the lifespan, puberty, pregnancy, menopause, those key points where estrogen is in high flux. If there's something not quite right with how estrogen's being metabolized, either at the liver level or at the gut level, or if there's something going on in terms of how these estrogen receptors are being expressed, or how the receptor is interacting with estrogen molecule, that's going to be our key focus. We're going to look at also mast cell stabilization protocols. Mast cells being a component of the immune system that are typically associated with histamine and allergic reactions. So I find that really interesting, but histamine is a very complex molecule. Mast cells are quite complex. We're going to be, I guess, from that immunology perspective and that inflammation management perspective. Is that how you would look at that?
Yeah, but also, the interaction between histamine and estrogen as well, because that's a bidirectional.
True. They are friends.
Yeah, they are friends. And also potentially the contribution that histamine can make. Oh, this is a bit convoluted, but via gut microbiome could be connected to inflammation, to being a pro-inflammatory trigger.
That's a really good point. Yeah, okay. We're also going to focus on stress management, which what an umbrella term for like so many different tools and techniques that we have in our tool bag, specifically for cortisol regulation, because if cortisol is, I guess, chronically high, low or high really, but I'm more so thinking of that chronically high picture where it can really contribute to that dysregulated inflammation, that unresolved inflammation that can be a key component in lipedema. And then pairing that with specific anti-inflammatory protocols that target that abnormal adipose tissue. And very quickly, how that would compare to lymphedema specific treatment, where we would be focused on preventing infection. We would use antimicrobial herbs, specific immune support, vitamin C, vitamin D, zinc. Then we're looking at specifically repairing the tissues. That includes looking at things like, again, zinc is probably the first one that comes to mind for me there, vitamin E, selenium as well, lots of minerals that are also really important to the extracellular matrix, and I think fascia as well. So thinking also about the supporting and surrounding structures of those lymphatic vessels, and supporting circulation. Anything that supports circulation, I think, is going to, in a ripple effect kind of way, support lymphatic flow. Herbs there, horse chestnut. I have a soft spot for horse chestnut.
Oh, me too.
And And butcher's broom is a really nice one as well for that.
Yeah. And actually that whole picture there, addressing the infection prevention, tissue repair, circulation enhancement, just says echinacea.
True. Oh, yeah, that would be a great herb there, yeah. And oh, yeah, echinacea, you know, it's such a powerful lymphatic herb and just gets often overlooked for that amazing impact. So, yeah, good shout out to echinacea.
And, of course, immune system function.
Yes.
Beautiful.
Now honing in a little bit more specifically on lipedema, and especially let's sort of summarize the impact that hormones, namely estrogen, can have on lipedema development. We've established in the research and the symptomology patterns that lipedema can specifically begin with or worsen at times where there are significant hormonal shifts. Puberty, where estrogen is really like coming online significantly for the first time in a female's life. We've got pregnancy, where estrogen increases across the pregnancy alongside progesterone. And then we've got menopause, and I think of more specifically those perimenopausal years where we can see those really sharp spikes, those sharp dramatic spikes in estrogen. It's not just, again, I really like to remind all of us that when we think about menopause, it's not just a flat lining of hormones. There's a whole sort of journey that happens before then. So yeah, I'm thinking specifically of perimenopause, where there's lots of estrogen activity there before post-menopause, where it does sort of decrease. There's a net decrease, and it sort of remains that way for many, many years. I did briefly mention the estrogen receptors. Now, specifically, there are estrogen receptors in adipose tissue, in fat cells. We have estrogen receptor alpha and estrogen receptor beta. There is some emerging research on how this is specifically related to where this comes into play with lipedema. But what we know is that the receptors are present in adipose tissue. We know that these receptors influence where fat is distributed and where it can accumulate. And if we think of those estrogen-specific areas where fat can accumulate, it's usually around the hips, around the bum, around the thighs. Are there any other areas that you associate with estrogen fat accumulation?
Breasts.
Yeah, naturally.
When you're talking about beta receptors, when I'm thinking of the soy isoflavones that bond to beta receptors, a weak bonding to the beta receptors, and I'm wondering whether soy products or flax seeds might also form part of a treatment to, as an alternative to, say, something like dairy that's going to be more pro-inflammatory. Drinking an organic soy milk might be a better alternative. So
absolutely,
small tweaks like that might also help.
Yeah, nice. Oh, good thinking, yeah. The other important aspect when it comes to estrogen and this adiposity is that estrogen can fuel the proliferation of these adipocytes, these fat cells, and affect how they differentiate in the body. This can potentially lead to the disproportionate kind of appearance of the fat accumulation that we see in lipedema. And then this is less strong on my radar, but it's on my radar nonetheless. Estrogen impacts vascular permeability, so I guess how much blood flow can get to certain areas, and lymphatic function. So estrogen is having an impact on vasculature and lymphatic function that can, I guess, add to edema in these areas that are already affected by the lipedema, and promote some tissue changes in those areas as well.
Yeah. I'm interested when you talk about the vascular permeability. So yes, it'll affect how well fluid travels to the extremities, but it's because it's talking about the permeability of the vascular system itself. and how, I mean, as it gets to the extremities, it is more leaky.
In terms of like capillaries, like being small. There's a lot of exchange at the capillary level, right? Like there's more. There's more leakage. There's more things going in and out of the vessels.
I remember this being really fascinating when we were studying it, but the way that our blood vessels allow fluid to cross over at certain times, and certain types of fluids to cross over, and so there's an intricate relationship between our vascular system, our blood flow system, and our lymphatic system, because there's this exchange of fluids that comes from it. And it's interesting to note that estrogen has an impact on that. I did not know that.
Very interesting, yeah. So I feel like I'm going to learn the most from this part. And Julie, if you may lead the way, let's talk about how lipedema fat is different from regular fat.
Yeah, this is fascinating. So lipedema fat contains hypertrophic adipocytes, which just means enlarged fat cells, with abnormal fluid accumulation between the cells. Whereas regular fat is just normal sized fat cells with just normal intercellular spacing. Lipedema fat has this high water content, and inflammatory infiltration. So the inflammation is within these fat cells. Whereas standard adipose tissue, so standard fat cells, is just, they're not inflamed in that.
Or have that higher water content.
Yeah.
Wow. Okay.
There's also a response to weight loss. So lipedema fat is largely resistant to diet and exercise, and if it does respond, it often doesn't last or reduce it in size. Regular fat responds predictably. Yeah.
What a stat.
Oh, yeah, we can predict it. To calorie deficit through diet and exercise. Yeah, I mean, yes, it does, but there's nuance there that we're not going into today. Lipedema fat may require specialised liposuction techniques for removal? Question mark.
And again, we've got our thoughts there.
Yeah. Regular fat can be reduced through conventional weight loss methods. Again, question mark.
Again, asterisk.
Yeah. Texture and feel. Okay, so the lipedema fat is soft and doughy, like cottage cheese, nodular, dimpled kind of effect. That typical cellulite kind of look to it. Whereas regular fat's firmer and more uniform. Lipedema fat is often spongy, whereas regular fat is smooth and consistent. Lipedema fat is painful to the touch. It's pressure sensitive. I have heard women say that they can't wear clothes on it at sometimes when it's particularly painful. Even just having clothes on it can be so painful that they can't tolerate it. Obviously, regular fat's not painful. Lipedema fat may cause aching, burning, or heaviness sensations, even at rest. Obviously, regular fat doesn't have that. Lipedema is chronically inflamed tissue with increased inflammatory markers. Lipedema fat may have altered immune cell infiltration, so the M2 macrophages. And of course, neither of those things is present in regular fat. The blood supply is different, so there's often increased vasculature, which is angiogenesis. So this is where a new blood supply is formed in these cells.
And that reminds me of estrogen as well, because we know And when we say estrogen, actually, and there are kinds of estrogen that are more associated with adiposity and fat cells compared to other forms of estrogen. So I think I just wanted to add that layer of nuance in there, but I'm thinking like, yes, when we think of hormones, estrogen is generally the proliferative one, and in some cases, certain forms and metabolites of estrogen can add to that increased blood vessel formation. And I was just thinking about that part before, where we now know estrogen affects that vasculature permeability, and I'm like, ooh, is that exacerbating this blood supply component in lipedema?
Interesting. And
Or is that just a part of the inflammatory process as well? I'm not all of the above.
yeah, that's interesting too, because I know that lipedema does often occur alongside obesity. So I wonder if estrogen is actually a driver in both aspects.
Yeah.
Interesting.
And I would imagine so, yeah. And I'm going to do a mini shout out here and just say that if this is something that you're struggling with, on its own, but maybe also with some other hormonal imbalances just in your life, this is where a Dutch test, dried urine testing for comprehensive hormones, could be really, really valuable in terms of how those test results are going to help you and your desired practitioner understand the breakdown of the different kinds of estrogen in your body, the proportion of the 3 major types of estrogen in your body, but more specifically how they're each being metabolized. This could be a huge key, especially if this is something that is affecting you long term, and again, maybe with some other hormonal imbalances as well. It may be issues with your cycle or fertility issues, PMS, PMDD, painful periods, tender breasts before your period, things like that, those really estrogen specific pictures. Having those results could be a game changer in your treatment. I don't always like the notion of test, don't guess. Like, there is always, Julie and I think both of us, we're firm believers that there is always so much you can do without the need for these expensive, elaborate tests. But the Dutch test is one of my favourites, and I'm just thinking of a complex hormonal case where there's perhaps obesity with lipedema and some other things going on. Dutch test could truly
absolutely
help.
I agree entirely. And even in a perimenopausal woman, I think that would be really, really helpful, even though you're going to get this, it's going to be a snapshot in time in the midst of surges and withdrawals. It would still be helpful to see how you're metabolizing. That's the important factor. Yeah, I agree. I love a Dutch test. Just to finish off the differences between lipedema fat and normal fat, lipedema fat, of course, may bruise more easily due to fragile blood vessels. So that just
adds another
makes me think, okay, so we're going to be treating the vasculature system as well, because if you've got fragile blood vessels, that has implications for your cardiovascular system.
Yeah, and that makes me think of specifically just maybe, I feel like tissue salts could be really an interesting strategy to incorporate. I'm thinking of silica. I'm thinking of like a combination of ginkgo and gochu kola, like those, and horsetail, being a silica-rich herb. That's where it gets my brain thinking.
And tremella and blueberries, any of the dark purple, dark reds, the polyphenols.
Polyphenols, shout out.
Yeah, green tea. Not too much.
Yep.
Yeah.
So now we know what lipedema is, how it's different from regular fat, the role that hormones play in it, how it's different from lymphedema, although it's commonly confused for lymphedema. some other treatments that we can consider for lipedema
include magnesium oil, Epsom salt baths, which can relieve the muscle cramps, support the vascular tone and promote relaxation. Horse chestnut or arnica cream. Now, I don't mention this very often, but I do have my own formulation of a magnesium-based cream. And
they're incredible.
Thank you. Thank you. I got the most beautiful message just this week about my magnesium cream and how much it helped 2 people to sleep when they were having sleep issues. And it was really gorgeous. I'll share it with you later. But to this cream, I can add herbal medicines. And I have made formulations specifically for lymphedema, but I could also do that for lipedema as well. And it's just a matter of adding these topical herbs in to support inflammation, to support tissue healing, whatever it is that's needed in that particular case.
Beautiful.
But there's also horse chestnut or arnica, which I could add to these creams, but you can buy those over the counter as well. Contrast hydrotherapy is also another strategy. So alternating hot and cold showers to stimulate blood flow and lymphatic pumping. I think if you've got painful lipedema, that might not be tolerable.
Yeah, proceed with caution.
With caution, yeah.
And maybe just starting with let the contrast be the application of perhaps some gentle heat packs to the affected areas, and then the contrast being the removal of those heat packs rather than doing an active cold with an active hot, for example, in the shower. But I could see how that could be helpful,
And I would think that would be more helpful in lymphedema than it would in lipedema, to be honest.
Yeah. So it might be good for that presentation where there's a bit of both, or it's just helpful for the lymphatic component that is present, that fluid build-up between those fat cells in lipedema.
Yeah. And then
get things moving.
And then there's some mind-body practices, which yoga and Tai Chi and Qigong is another one.
Qigong, one of my favourites.
Just to improve that lymph movement. As we said before, Lymph Love Club. Leah has some wonderful techniques. I love Tai Chi for enhancing joint stability and reducing perceived stress. Well, all stress is perceived. But
good point.
But I'm not going to go into that in detail.
That's
meditation, mindfulness, any kind of mindfulness practice is going to be helpful for managing chronic pain, anxiety, and body image distress, or just the treatment you've had from not being heard. Counselling and support groups. Well, that's going to be something. Oh, well, we kind of do that in naturopathy. It's part of what we do.
Absolutely.
But I think if you've had a lifetime of experiencing this and not getting treatment, then maybe counselling and support could be something that's helpful for you.
And I'm thinking that there may be some helpful, if I'm just thinking of the age of the internet, there may be some really nice Facebook groups or even like Reddit, like subreddits for people with lipedema. And it might just be helpful to hear about different people's experiences and what they've tried and what's worked for them, or, how they live with it. So I might have a suss of those and add those to the show notes. So we want to wrap up with a really important component of a naturopathic treatment strategy that we would incorporate with someone experiencing lipedema. And, every time this comes up, I think I can speak for us both when we're like, oh my gosh, this is just important for everything.
Yeah.
It literally affects everything. So Julie was doing a little bit more research, and she discovered how there's an association, we'll say, with lipedema and insulin resistance, and how focusing on circadian rhythm support and boosting melatonin and honing in on what we call chrononutrition, which is a term that I actually really love, how they can support lipedema.
Yeah.
So you got into a bit of a blog from a nutritionist. Tell us about that.
Yeah, so a nutritionist called Kimi Kati, who actually specialises in lipedema and lymphedema treatment. And she talks about this association between... She's also mentioned to what we were talking about earlier, where there's this association with lipedema in obesity. So lipedema and insulin resistance. Insulin resistance can go as far as turning into type 2 diabetes, but it can be pre-diabetes. So it's a precursor to that, and it can be present in obesity as well as a contributor. And one of the ways that we can address that is by improving sleep. It's not just about sleep. Circadian rhythm is the way that the body understands at a cellular level. So every cell needs to know what time of the day it is in order to know what it should be doing. It also interacts with sleep. Sleep improves melatonin production. So that's another bidirectional thing, where the better our sleep is, the more melatonin we produce. The more melatonin we produce, the better our sleep is. The other aspect of melatonin, which is really, really important, is that it is a natural, very potent anti-inflammatory. And it can assist in insulin's sensitization. So it can mean that if we get our circadian rhythm and our sleep aligned with the rising of the sun and the setting of the sun, we're optimizing this ability to reduce inflammation, and we're optimizing the production of melatonin for its anti-inflammatory properties. And I should also say at this point too, there are the two kinds of melatonin. There's the intracellular melatonin, which is produced in the presence of sunlight, and then there is the pineal melatonin, which is produced for sleep. Both forms are potent anti-inflammatories. So it's one of the ways that we can also enhance our circadian signaling, our circadian rhythm, is by acknowledging this day-night cycle in the way that we eat. And so that we can make sure that we're eating between sunrise and sunset, but also focusing on, and this is not so much circadian rhythm, but focusing on ensuring we get sufficient protein in the morning. So many women don't eat breakfast. So many women don't eat enough protein, and certainly don't get enough protein at breakfast. If you have sufficient protein at breakfast, it helps mitigate bad choices later on in the day because it's more satiating. That was a lot to unpack.
But I think, again, just really important to highlight how this, I don't know, somewhat simple thing, this day-night cycle that we all live under, we all have it in common, unless you're an astronaut, currently not on Earth.
In which case, it's going to impair the function of your body because you're not getting in the same way that it does with with shift workers too, and people that have sleep cycles that are not in alignment with sunrise and sunset.
And
so I neglected to go through those important steps that we would those very fundamental steps that we would go through to improve our sleep-wake cycle.
You neglected to go through it because it's something that Julie and I talk about all the time together at Julie's library talks and with our clients, you know, and just in naturopathic spaces and health-related spaces. We're actually going to record a masterclass on circadian rhythm optimization, circadian signaling, how you can use your sleep-wake cycle, how you can optimize it, how you can use the signatures of night and day to improve all aspects of your health. There are just some fundamental things, recommendations that we have that actually are just so general that we recommend to so many different kinds of clients that we just want to put it out there for you in a nice digestible format. So if you're keen to learn more about this component of the naturopathic treatment strategy for lipedema, but as I mentioned, also for literally any other condition or symptom, check the link in the show notes for our circadian rhythm masterclass.
Yeah. Stay tuned.
Stay tuned. So, if you didn't know what lipedema was, and you're just a lovely fan and you just listen to all of our episodes, we hope that we've shed some light and understanding on what this is. And, you know, and I bet someone's going to listen to this and be like, oh, wow, geez, I wasn't across this before. And then within a week or fortnight max, they're going to hear a story about someone that's experiencing lipedema, or they're going to, you know, that thing's going to happen. And you'll have this podcast as a resource that you could potentially offer them. And at the very least, you can have some extra compassion for them. You're like, oh my gosh, I've recently learned all about lipedema, and like, it can be painful and it's so complex and like misdiagnosed, and my gosh, like, you know, tell me a bit more about your story. So shout out to that. If you do have lipedema, we hope this podcast episode has given you some insight on what might be driving it, specific in your case, but also just sort of those underlying qualities of lipedema in general, and maybe some things that you can start to explore to get started on perhaps what's an alternative treatment journey for you. Maybe you feel let down by the conventional system so far and the conventional strategies and treatments that you've been offered. Maybe you absolutely do not want to get liposuction on your thighs, or, you know, so we hope this is the start of your more holistic, complementary path to this. And should you require more tailored, direct support, if you would like a naturopath looking at the whole picture of the being that is you and all your body systems, and how your unique life and history and routine and all your systems working together could be influencing your lipedema picture, you can book a connection call with Julie
or
in
Karinda.
The show notes. Hey!
I think this is a really great example of how naturopathy works. Like, this is a condition that, okay, so neither of us were very familiar with it, but both of us are very confident in treating somebody that comes through the door with lipedema, because when with naturopathy you break it down to the you know, the root cause and the contributing factors, and you treat those things, and in that way we can virtually treat anything that comes through the door.
Hey there, it's nighttime editing Karinda here. In a Nuanced Naturopaths first, the end of our episode just doesn't exist. This has been a complex episode to edit for many technical reasons that I won't bore you with. And it seems like we were just about to wrap up the episode, and then all audio and the rest of my video just doesn't exist. So we're going to leave you in the nuanced grey area as to how that episode actually ended. You're going to have to sit in the grey, in the nuanced grey mystery for that one. But as we mentioned in the episode, we will put some links in the show notes for lipedema support. If you would like support with your own lipedema journey, or would like to recommend us to someone who you know and love who has lipedema, you can book in a cost-free and obligation-free connection call with either Julie or myself. All relevant links are in the show notes below. As always, thank you for listening. If you like what you hear, please give us a follow on Spotify or subscribe to us on Apple Podcasts. You can now also subscribe to us on YouTube. And yeah, if you have any questions, let us know. If you hear about anything related to health or medicine or natural remedies and you're like, is this legit? I want to get a nuanced take on this topic. Let us know. Send us your questions. Again, there's a link to a contact form in the show notes below. Write to us. Let us know where you're listening from. Let us know what you like about our podcast. Give us a question that we can answer on the podcast. We'd love to do that. We will catch you in the next one, guys. Take care.